Hey guys, William here from fitnessforbackpain.com. In today's video, I'm going to show you some awesome front plank progressions. If you have a sensitive lower back, if you are post-fusion or post any kind of surgery, or you've got some chronic back pain going on, I want to show you the safest way to do the front plank. Now, there's different kinds of variations to the front plank, so I'm going to show you where you should start, how you should progress them, and how to cue yourself to make sure that you're doing them to fit you best. If you haven't already, make sure you go over to fitnessforbackpain.com if you want to learn how to use exercise, lifestyle habits to address your chronic low back pain. I'm giving away a free video workshop. It's absolutely free. It goes into detail on some of the biggest topics that people are messing up terribly when it comes to using exercise to beat and get more control of your lower back pain. All right, so let's check out the front plank. Just like any other exercise, you can modify it. There's lots of different variations. The first one I'm not going to show you just because it's very, very simple. You can try it out. It's not hard to mess up. It's just the standing wall front plank. So if I had the wall here in front of me and I would be leaning up against that wall into a front plank position. So you'll see the front plank fully here in a minute. Imagine you doing it here. So the further my feet are away from the wall when I'm in this front plank position, the harder the exercise is going to be. So the more you're standing upright, so here's the wall, the more you're standing upright and leaning, it'll be easier. If you're kicking your feet out a little bit more and you're in that front plank position, that's gonna be a little bit more difficult. So that's the easiest version for the most sensitive. Now let's do the on your knees front plank. So when it comes to the front plank, there's a thing you do with your hips that really makes the biggest difference in both protecting your spine, but also just making the exercise really effective and really efficient for the time that you're down there for. And I'll show you what that is. So I'll get into position here, hands and knees, dropping my knees out to where I want them to be. Before I get down, what I'm gonna do is I'm gonna squeeze my glutes, get those nice and tight, contract my core, and I'm gonna drop onto my forearms here. Okay, so as you can see, my butt is still up in the air. This is not a front plank. What you're gonna do is you're gonna tuck your pelvis under, so squeeze your glutes, tuck under, and then I'm gonna drop into this position here. So when I'm here, I'm gonna push up against the floor. I'm taking my elbows, and as if I'm sliding my arms to my knees. That's the goal. And then the same thing goes with my knees. I'm thinking about sliding my knees up to my elbows, so I'm almost doing this in the plank, but obviously you're not moving anywhere. So here, core's on, butt is tucked under slightly, and I'm gonna contract and bring my elbows closer to my knees, bring my knees closer to my elbows. Nice, good contraction in the trunk, and you're done. That's the knee side, right? So let's go into the full front plank. Very similar, so the rules still apply. You're still doing the pelvis, the glute contraction, the shoulders, the pressing out, bringing your elbows to your knees, knees to your elbows, same idea. Key thing here is it's a lot harder, obviously, so you can change it up by dropping one leg, so you're only doing a one-legged or a one-leg plank versus a two-leg plank. But the key is to keep that pelvis tilted under to give that core most of that work that this exercise is doing. So same idea, I'll get onto my knees, get into a good position here, kick my leg out straight, contract that glute, get everything nice and tight. Then I'll simply lift the other leg up, and now I'm in position. So I'm holding here, bringing my elbows to my toes now, and my toes to my elbows, and I'm trying to hold this position nice and comfortably, as I guess as comfortable as a plank can be. Pelvis tilted under, and I'm holding for the desired time.